HACCP concept in Abattoir Management. HACCP concept in Abattoir Management. What does HACCP stand for? H. Hazard. A. Analysis. C. Critical. C. Control. P. Points. What is HACCP? Hazard Analysis Critical Control Point. Internationally accepted food safety management system ensure that the product is safe and will not cause the harm to the consumer. The HACCP system is solely related to food safety, and not product quality. Definition: HACCP: a systematic approach to construction a food safety program designed to reduce the risk of foodborne hazard by focusing on each step of the food preparation process. A dynamic protective concept to ensure safe production of food product based on a standard set of principles used by food producer handlers. History of HACCP: 1959 Pillsbury Company and NASA and United States Army developed HACCP concept to provide safe food for astronauts during manned space mission. 1963 Codex Alimentarius Commission WHO FAO formed to develop food standard codes etc. 1971 Pillsbury present HACCP concept at conference in USA. History of HACCP: 1973 HACCP was adopted by the US FDA for low acid canned food. 1980s adopted by many major food production or processing companies. 1985 US NASA recommended HACCP to provide safe food for astronauts. 1996 Codex Committee on Food Hygiene CCFS developed revised HACCP system and guideline. History of HACCP: 1997 the US FDA made HACCP mandatory for all seafood processors in the US as well as for those foreign plant exporting food to the US. 1998 Canadian Food Inspection Agency CFIA made HACCP mandatory for all Canadian safe food procedure. 2007 CFIA implemented HACCP mandatory for meat and poultry industry. Prerequisites: process which provide the basic environmental and operating conditions necessary for the production of safe, wholesome food. To program good manufacturing practices GMP, sanitation standard, operating procedure SSOP. The 7 HACCP principles: perform a hazard analysis, decide critical control point CCPS, determine critical limit at CCPS. The 7 HACCP principles: establish monitoring procedure, establish corrective actions. The 7 HACCP principle: establish verification procedure, establish record keeping procedure. Principle first: perform hazard analysis. Identify step in process where hazard occurs. List all identify hazard associated with each step. List preventive measure to control hazard. The potential to cause harm. Hazard. What is hazard? A property which may cause a product to be unsafe or unsafe for consumption. Biological hazard: any disease spread organism found in food which may cause illness to the consuming individual. Chemical hazard: any substance used or in contact with food or developed by a chemical process or processes which may cause illness to the consuming individual. Physical hazard: any physical matter not normally found in food which may cause illness or injury to the consuming individual. Biological hazard: microorganism, bacteria, virus, parasite. Chemical hazard: chemical substance in food, naturally occurring added chemical naturally occurring natural toxin, mycotoxin, added chemical, incidental or added chemical, agriculture chemical, example pesticide, antibiotic, permitted additive, preservative, coating agent, anti-caking, indirect additive, lubricant, detergent, sanitizer, paint, physical hazard, physical substance in food, foreign object ranging from 7 mm to 25 mm, metal fragment, air, glass pieces, insect, chips dropping from rodent, wood store. Principle 2. Decided decide critical control point. Critical control point. A point, step or procedure at which control can be applied and is essential to prevent or eliminate a food safety hazard or reduce it to an acceptable level. Principle 3. Determine critical limit. Critical limit, a maximum and or minimum value that must be controlled at HACCP to prevent, eliminate or reduce to an acceptable level of food safety hazard. Example, temperature monitoring equipment, thermometer. Principle 4. Establishment of monitoring procedure. Monitoring is a scheduled observation of a CCP and its critical limits. A planned sequence of observation or measurement to assess whether a CCP is under control and to maintain an accurate record. The procedure must be reliable enough and performed often enough to ensure that the hazard is under control. Determine what will be monitored, how it will be monitored, when it will be monitored, and who will perform the monitoring. Principle 5. Establish corrective action. When there is deviation from an established CCP, corrective actions must be taken to prevent a product that may become unsafe from reaching to consumer. Corrective action must include correcting the problem and putting the process back in control and placing the product on hold pending evaluation of safety. Corrective action step taken must be documented. Corrective action. Example, Salmonella in raw chicken is a hazard. Cooking is the critical control point to eliminate the hazard of Salmonella. 165°F for 50 seconds is the critical limit that must be met to ensure the hazard has been eliminated. Monitoring is by calibrated thermometer. If the temperature is not 165°F, then a corrective action must be taken. Continue to cook the chicken until the internal temperature reaches 165°F for 15 seconds. Principle 6. Establish verification procedure. Verification, those activities other than monitoring that determine the validity of the HACCP plan and that verify the system is operating according to the plan. Establish regular procedure to verify whether the above measures are working effectively. Principle 7. Establish record keeping procedure. HACCP record is the in-plant record keeping that is done at each CCP and contain information required to ensure that HACCP plan is working correctly or not. 4 kind of HACCP record. HACCP plan or support documentation used in developing the plan. Record of CCP monitoring, record of corrective action, record of verification activity. Sum up. Hazard analysis of critical control point strategy. Versatile system which can be used to manage the occurrence of health hazard in food and water. Can also be used to manage public health hazard in slaughterhouse meat processing plant. Main component of HACCP are contained in the 7 principles. HACCP is in use worldwide and is endorsed by WHO and FAO. Sum up. Food safety. Food process under effective HACCP system will increase food safety. Market access. The marketplace is increasingly demanding adoption of HACCP. Reduce cost to the company disposal of contaminated food due to microbes or foreign body or chemical residue, application of HACCP, opportunity for international trade are enhanced where food is produced in a strictly hygienic environment. Countries that follow strictly hygienic practices gain reputation as a produce of safe food, reduce for borne illness, provide confidence for food safety management. Application major institutional buyer priorities as a CCP critical meat and meat product. Important importees imports insist of a CCP certificate essential to meet the standard of retail food chain and food safety. Prevention through process control HACCP, a well and sure concept. Benefit of HACCP food safety. Food processed under effective HACCP system will increase food safety. Market access. The marketplace is increasingly demanding adoption of HACCP. Additional benefit reduce cost of processing or product waste, improve product quality and consistency, reduce risk, increase business protection. Advantage over current system focuses on identify and preventing hazard from contaminating food based on sound science, permit more efficient and effective government oversight, place responsibility for ensuring food safety on food manufacturer or distributor. Advantage 2. Help food companies compete more effectively in world market, reduce barrier to international trade. Thank you.